Good morning, everybody. For those of you in the back, please feel free to come. We're going to make this a more intimate setting. So if you're in the back and you want to come up a little bit, we'd love to have you up a little bit more. We're just going to give a couple more minutes for people to make their way back in. All right, well, let's get started. I'm really excited about this part of the presentation. We've had some videos from some of our most prominent elected officials, or officials that couldn't be with us today. But I have the pleasure of introducing a video from Secretary Carlos Gutierrez. Now, Secretary Gutierrez is perhaps the most inspirational person that I've ever had the honor of working for. His story is, to my mind, the embodiment of the American dream. And it's no doubt that many people admire him for all that he's accomplished. In fact, my wife would probably admit that she has a slight crush on him. Born in Cuba, he and his family fled Castro's oppressive regime and found their way into the United States. He learned English from a bellhop in Miami and eventually rose through the ranks of the Kellogg Company to become its CEO. Then in 2004, he heard the call from President George W. Bush. He said, please join my administration as the 35th Secretary of Commerce. He led us through the Gulf Coast recovery. He led us through tough negotiations with Congress on immigration reform. And he made opening markets around the world, opening markets to U.S. exports around the world, a top priority. So let's listen to see what Secretary Gutierrez has to tell us.
Saludos a todos. The Hispanic Leadership Network Southwest Regional Conference. Along with my friend, Governor Jeb Bush, I was honored to serve as co-chair of the inaugural conference that was held in Miami in January of 2011. We witnessed the enthusiasm and commitment of Hispanic leaders from across the country who understand the importance of advocating for center-right policies in dealing with our nation's challenges. I am delighted to see this energy spreading across the country and reaching New Mexico, where Hispanics play such a key role in changing the course of our faltering economy and rebuilding the American dream for all Americans. I commend the Hispanic Leadership Network for hosting this conference. I salute their commitment to growing the number of Hispanics who are engaged in the political process. Under the leadership of Senator Norm Coleman and Fred Malek, the American Action Network understood the need for strengthening our long-term ties to the Hispanic community. With the creation of the Hispanic Leadership Network, more Hispanics will have the tools and resources they need to educate themselves and others about center-right policy solutions that can get our country back on track. I also want to recognize two outstanding governors who are true reformers in their states, Governor Susana Martinez and Governor Bobby Jindal. We need more national, state, and local leaders like them who understand that economic prosperity and opportunity are created by fostering a positive business environment, removing needless government regulations, and lowering taxes. As former Secretary of Commerce and business leader, I recognize that to strengthen and stabilize our economy, the government needs to support, not burden, small businesses. More reckless spending and growing our debt will not strengthen our economy. To help us be more competitive globally, the government needs to act now to pass trade agreements with Colombia, with Panama, and with South Korea. We want to encourage investment in the United States. We have the most talented, the most skilled workers in the world, and they can bring America back to greatness if we adopt center-right policies that create economic prosperity and empower our entrepreneurs. I am grateful for organizations like the American Action Network and the Hispanic Leadership Network, which are focused on bringing these policy solutions to our leaders. Once again, muchas gracias a todos for being an important part of this effort, y les deseo mucha suerte y muchos éxitos. Gracias.
He's awesome. He's absolutely awesome, and he knows what he's talking about. As the former Secretary of Commerce, he's just absolutely wonderful. I am now pleased to announce that in a few moments we will be giving all text messaging subscribers a sneak peek at a video from one of America's newly elected members of Congress. To be sure you receive this clip, text leaders to 97180 now, and you will get a sneak preview of that. Again, it's leaders, Leaders, to 97180. Okay, you'll get that. I know some of you are doing it right now. Okay, so we are ready. You know what I should say? Because some of you were not here yesterday, right? A couple of you. So you have no idea who I am, and I just come up here. And, well, I told everybody that I would be your BFF for yesterday and today. But so for the people that don't know who I am, I'm Rosario Marin. I am the former treasurer of the United States under George W. Bush. So just so that you know. Okay, Mercy, we're ready for our last panel, and it will be on healthcare. With the signing of the massive healthcare legislation, small businesses are concerned about the rising cost of healthcare, unconstitutional mandates, and increased regulations. So the question becomes, how can we afford healthcare? Today, we are very fortunate to have with us national and state experts on healthcare policy who will delve in the complex issue that it is healthcare. We are joined by my very dear friend, Josefina Carbonell, former Assistant Secretary of Aging at the U.S. Department of Health and Human Services, who will serve as the panel's moderator. Thank you, Josefina, for being here. I love you. New Mexico Secretary of Human Services, Sidney Squire. Thank you so very much. And it's not the same suit, just so that you know. And New Mexico Secretary of Healthcare, Catherine Torres. Thank you so very much for being here with us today. And Dr. Russell Petrella, President of United Health Group. Thank you so very much. Go ahead.
Thank you. Thank you, Rosario. Good morning, everyone. Thank you, each and every one of you, for being in the panel. I wanted to frame the issue of healthcare because it's such an important issue, but it's a very complex issue. So if you bear with me as I guess, chair of this panel, I'll try to just do a roundup. Our nation has arrived at a critical juncture in history. And as the baby boomers age and America's older population grows larger and more diverse, our country faces real challenges, but again, real opportunities for its future. Healthcare is about how we, individually and collectively as a nation, will provide and pay for healthcare and how we will care for our loved ones as we age. The older population of yesterday, the greatest generation, made enormous gains in health and financial security. Now, preserving those gains for the next generation will require discipline, planning, and a lot of action. Every 5 minutes in the United States, 23 individuals are turning 65 years of age. And in less than 15 years, that number will double. In just under 10 years, more than 50 million Americans will be over the age of 65, and for the first time in our history, the elderly will outnumber children under the age of 5. Right now, Hispanic elders represent just 7% of the older population in the United States, but in merely 6,200 days, Hispanic elders will be the largest minority population among the elderly in this country. As a matter of fact, the proportion of older populations that is Hispanic will continue to greatly increase over the next 4 decades. As a matter of fact, 6-fold duplication in compared to the non-Hispanic population. So again, there's very significant events that influence the quality of healthcare in America and our challenges and opportunities, and frankly, our sense of urgency for leadership in this area. The first and most obvious is the very significant increase in the elderly population as a result of the baby boomers. But again, the second one is one that people don't necessarily know about, and that's the increase in chronic conditions and unhealthy lifestyles that if we continue, we will not be able to meet the demands of a chronically ill older adult population. Having worked at the community level, I knew, with families, with children, preschool all the way to elderly people, I knew very well the kinds of demands and challenges that these kinds of strategies have had in the community. So in the context of the work that we did at the federal government, we really set out to find much more efficient and consumer-focused, developed accountability records, and also, most importantly, reward innovation and creativity. But the baby boom and the dramatic increase in healthcare costs in the United States have created an incredible imperative that we must take action. In this time of exploiting numbers of aging adults and tight budgets and record deficits and of complicated interactions among the health and long-term care sectors of the economy, it is clear we cannot afford to lean back on the simple programs and policies of the past. There's a widely held aspiration in our country that every American should have access to basic health care at an affordable price. There are competing visions of how we reach that and what kind of system we want to create. Some envision a system run by the government, but we have a different vision, one where consumers define the priorities, one where doctors and hospitals are paid on the value of what they provide, and one where taxpayer dollars are used to help those in hardship situations, those in most critical need. In order to do this, we must first address the financial security of Medicare, since it drives health care in this country. Medicare and Medicaid also will collectively spend $10 trillion over the next decade, not a small amount. It is time that we get serious about this issue, and it is our responsibility as taxpayers to get this right. We need to continue to increase the transparency of our healthcare system and get better value for our care. I want to turn to the rest of our panelists as experienced members on the ground, both at the state level and in the corporate healthcare delivery system, to give us a little bit of background also.
Well, why don't you let me start, because you gave me a great lead-in, and that you talked about Medicare and the volume of Medicare. Well, you all should know that Medicaid is taken over, and it is a bigger health program than Medicare. It's the largest health program in the country. And I, as the Secretary of Human Services, I oversee the Medicaid program in New Mexico. So I just want to give you a little rundown on where I see Medicaid at this point, because it is the biggest health program in this nation. Medicaid is 45 years old, and it has not changed a bit. The system has not changed a bit, except for to expand. I don't know if you know this, but Medicaid was originally supposed to be an insurance program, for low income. But now it is a comprehensive social program for low income, elderly, disabled, and children. And don't forget the children, because they are eating up a lot of the budget. So I think the reason that I'm sitting here, I want to sit here today, is to tell you that Medicaid, as we know the system right now, is unsustainable. It's unsustainable nationwide, and it's unsustainable here in New Mexico, primarily because we're a pretty poor state, and we have a lot of people who use those services. There are people right here in New Mexico that are arguing with me, and they say to me, Medicaid's fine. You don't need to do anything. You don't need to reform it. You don't need to bring it along to the 21st century. It's fine. And they justify that by saying that the federal government has promised billions of dollars to come into the state so that when people come onto Medicaid, they're going to pay for it, and we don't need to worry about any of that. Well, I don't know what those people are smoking, but they are clearly not watching what's going on in DC today. If they really believe that the federal government is going to ride to Medicaid's defense, then I just don't buy it. I don't think so. The truth of the matter is Republicans and Democrats, they both parties know that Medicaid is out of control and unsustainable. If you think about it, a while back, you used to have a telephone, some of you will remember, some of you won't, where you had to dial up and there was a cord in the wall. Well, now you've got one that just, you take anywhere you want to go. It's evolved. You used to have a typewriter. Some of you guys will remember that, and you had to put that little piece of paper in there to fix a typo. Well, now you got a computer that spells for you. It used to be that you took days to get a piece of mail. You had to wait for a package for days. Now you can have it by 10 o'clock tomorrow morning. Everything has evolved in this country. Technology, society has evolved, but Medicaid has not. Just this week, President Obama, a Democrat if there ever was one, rolled out his economic growth and deficit reduction proposal. And even he said in it, $72 billion, with a B, dollars of savings in the Medicaid program. That doesn't sound like the federal government's going to run to the rescue of the states in Medicaid. Governors, most recently, because they've seen their budgets soar due to Medicaid, they have called on the federal government to modernize. And that's what we're trying to do. That's what one of my goals here is to modernize Medicaid. If you think about it, the federal government sees all the states as one. There's one program that fits all the states. Well, you all know that Medicaid or a health program in New Mexico is different from the one in Tennessee, that's different from the one in New York, that's different from the one in Hawaii. But the government doesn't see it that way. They feel that we should just, whatever their rules and regulations are, go forth. Well, I don't know. Some governors say that Medicaid, their growing budgets, is going to bankrupt their state. I don't know about bankrupt, but I do know that in New Mexico, the Medicaid budget this year is 16% of the budget, and next year will be 18%. And if it grows by just even that 2% a year, a lot of good, important things are going to be pushed out of the budget, and Medicaid and education will be fighting. But public safety and environmental things, and I was in a hearing just the other day, and there were some senators, and they were arguing for a wastewater treatment plant, and there was no money. There was no money. Well, I know wastewater treatment plants aren't sexy, but think about if you don't have them. What happens if you don't have them? I mean, you need them, and the Medicaid budget is going to just push those kind of things out, so there'll be no money. So I'm asking the federal government for flexibility, and we are going to need all the flexibility we can get when Obamacare kicks in 2014. When national health care reform kicks in, New Mexico is looking at about 130 to 175,000 new people on Medicaid, new people. And for those of you who think that when you add people like that onto a government program that it reduces the deficit, I got a bridge I want to sell you somewhere, for sure. That's going to cost the state of New Mexico someplace between $300 million and $660 million. And I have no idea where New Mexico, I'm not even sure you could tax your way in New Mexico to that kind of money. I have no idea where they're going to get that kind of money. And again, I say, don't count on the federal government to ride to your rescue. Right now, 1 in 4 New Mexicans touch the Medicaid program, and it's my intention to modernize it so that this important safety net, which it is for people who really need it, we want it to be there for future generations, for now and future generations, and unless we do something about the way the program is, about how it's delivered, how its services are delivered, and how it's structured, we won't be able to do that in the future.
Thank you.
Well, thanks, Sydney. I want to thank Josefina for being here today, as well as Russell. And I appreciate the opportunity to be here with the Hispanic Leadership Network. I am the Secretary of Health for the state of New Mexico, and 2 of my key issues are I find it hard to believe that I have health disparities in a state that is multicultural. And my goal is to eliminate health disparities. And by eliminating, really it's about compassion and respect. And when we start looking at healthcare reform, we have to look at those are limited dollars, and how are we going to get people the best care for their dollar. But what we also have to do is reteach people something that my grandmother, who is now 102, learned is that you have to learn how to take care of yourself. And so you need to do prevention. So we need to go back to prevention. We need to teach people that you can't eat everything you want every day, every time. You need to do things in moderation. We do need to be active. We need to do things physically. That means all day long. I mean, we focus on exercising, or people need to go to a gym, but you should go out and walk every day with your family or your pets. Or you need to take the stairs, or you need to park further away. You need to have physical activity back into your lifestyle, and we need to promote that. And that is two things that we want to do in the state. The other big concern for me is, of course, the healthcare workforce. I live in a state that in 2008, 32% of the population in the state of New Mexico did not have access to a primary care provider, which is very concerning. So as we begin to look at healthcare reform, is how are we going to have providers available to give care? And I will tell you, as a physician, I didn't become a physician overnight. It took many years. In fact, I think it was almost 12 years, besides going the regular 12 years of high school, when you have to do residency. So my concern is looking at the generation between 16 and 24, and how we begin to make them understand about becoming a physician or a nurse practitioner or a counselor or a psychiatrist. And my concerns with them, as all of you know, is that they are idealistic and they are invincible. So when they look at DUIs, they think they're not a big deal. Or when they're social networking and they're doing Facebook and showing pictures of things they probably shouldn't show, that they will come back to haunt them as they go into their future. We all know, as physicians and nurses and counselors and psychiatrists and dentists, that we go through extensive background checks, through extensive credentialing, and that if you have a record, it does keep you from going into hospitals. Even as a student, we have students who can't become respiratory therapists because they can't do their clinical because of their record, because they didn't think the DUI was a big deal, or they didn't think some of this other stuff was a big deal. So it's our responsibility as leaders in this room to begin to help that generation, and we need to protect them. So we need to start, even though they don't want to listen, we really need to help them understand about social networking and the things that they do. Because for many of you in this room, if you got in trouble a long time ago, the police just took you home. Now they don't get to do that. So we need to do that. So my thing is that I really, as we begin to look at healthcare reform, we need to make the public understand the importance of prevention. Immunizations are the most cost-effective thing we do, and it was one of the biggest things we did in the 20th century. It's really important that people know that immunizations are important. That when you talk about wastewater, clean water was the other big thing in the 20th century. If people have clean water, they're going to be healthy. And so there are other things, just not insurance to people's health, but the whole thing about health, what we all do. We all are important to that. So that's where I stand today. Thank you.
Thanks. Russell. My name is Russ Petrell, and I'm with United Healthcare, and it's an honor to be here to join in this conversation today to give you somewhat of the corporate private sector perspective. Our focus and our goal, United Healthcare, you may have seen some of our advertisements recently, 78,000 people serving 70 million Americans. Our goal is to modernize healthcare. And the healthcare system that we have in place now is behind the times, and as a result of that, it's too expensive, and we're not getting the kinds of outcomes we're looking for. And let me give you a great example. Have any of you been to the dentist or doctor recently? When you go up to the window, the first thing they want to do is make a Xerox copy of your card. And then the next thing they do is they hand you the clipboard, the dreaded clipboard, yes. At which time you go through for the, I don't know how many time, your history. And for me, I'm always smirk when I see the question, are you currently pregnant or plan to be pregnant? We have solutions for those kinds of things because the electronic health records that are safe and secure and contain information help physicians, help healthcare providers provide continuity of care. They know when the last time you had your immunizations is. They know when you may have been, had some surgery. They are able to track down people who are doing drug-seeking behavior, people who go to the doctors just for pain pills. So there's ways that we can modernize healthcare. They're going to improve the quality of the outcomes we get and also reduce the costs of what we do. So that's what our focus is. The other thing that we really talk about is just plain old innovation. How can we do things different? How can we bring technology? How can we bring kind of the power of the private sector and the research and development activities that we're able to bring to bear on healthcare issues? We serve people. I'm responsible for 25 states of Medicare recipients. And in that, I serve 2 million kids. 2 million children I have the responsibility for making sure they get their health care services. I worry about their immunizations. I worry about prenatal care. And so we're trying to figure out new ways to approach kids, approach families, to engage them in this process. Healthcare is all about behavior. I'm a clinical psychologist by training. I can't just tell people. If I told all of you, now, I want you all to lose weight and quit smoking and exercise more. Okay? I've told you that. That's my professional opinion. Come back in 90 days, and we'll see how you all did. I don't think it's going to work. In fact, I know it's not going to work. Because if it was just telling people, how many times have you been told to floss your teeth every day? Okay, how many of you floss your teeth every day?
I do.
Oh, show offs. I usually get the lecture from the hygienist. So, we're looking at ways that we can do things differently. And let me just kind of wave a couple things around. We've partnered with Sesame Street, American icon Sesame Street. And the reason we've done that is that if I tell kids that if you feel like you have symptoms of asthma, use your inhaler because it's better for you to use your inhaler than end up in the emergency room, which costs $1,000, $2,000 for a visit. People aren't going to listen to me. But if I've got Elmo and Big Bird and Rosita, I think you're familiar with Rosita. Rosita is becoming the #1 most popular Sesame character, actually kind of pushing Elmo aside. We're distributing things like this. And we're distributing them at health fairs, we're distributing them at schools. And what we're trying to do is not just engage the kids, but we're trying to engage the parents. And so we're using these messages that we think are very compelling to engage people in preventative activities. It's much cheaper and better for your health to get services early on, to get inoculations. Right now, we're trying to convince moms to get prenatal care, because prenatal care is a huge determinant of the outcome of how children are born. We're trying to avoid premature deliveries. Premature babies end up in intensive care units, neonatal intensive care units. Any idea how much that costs, average? Between $1 million and $2 million a baby. A baby. So you want to talk about reducing costs? Well, the way we can reduce costs and improve quality is to get moms into prenatal care. Get them their vitamins, make sure they're eating well, make sure they're getting their checkups, and try to stretch the pregnancy to full term. We will reduce the number of kids. The kids have a better start, a healthier start, and the costs are reduced dramatically. So those are the kinds of things that we're thinking about to add innovation, to bring, I guess, a more rational, disciplined approach to healthcare and add some structure to the system. So let me stop there.
Well, I think this is wonderful. I think one of the most important things as we're looking at Obamacare down our throats, things that will start in October, as a matter of fact, incentives that have been built to states. You talk about, the stifling costs that you are looking at in the state of New Mexico and other states. Medicaid, for instance, originally was intended to be a program for poor families and children across the country, and de facto has become the long-term care payer for people that spend down to Medicaid in many states. And unfortunately, it's only serving 12% of the population. So again, Medicaid, I think the biggest expenditures in any state house that you go visit, and any governor, in any of the Medicaid agencies, the Medicaid budget, the long-term care budget is the longest. And it's because 7 out of $10 that are spent in long-term care in this country are spent in institutional-based care, when in the first place people want to remain in their home independently living as long as possible. So one of the ways that states have been trying to do this is what's called rebalancing. So I think that in Medicaid, we need to look at, part of the reform is obviously we cannot continue with the unspent, unbridled spending of Medicaid across any state, let alone any taxpayer. We've got to have some ownership over that, that it means something for somebody to come in and be able to pay part of that cost, to have ownership and consumer direction. That means that they have a choice, but also to be able to look at ways that we can rebalance when we're spending 70% of our dollars, Medicaid dollars, on long-term care, institutional-based care, when we could, for a fraction or a third of the cost, could keep people at home independently. So states like Tennessee, Arizona, obviously New Mexico, you've attempted to do a little bit of rebalancing, but freeing up those dollars, like they did in Tennessee, which they went to managed care, they put out a competitive bid, and basically 3 companies won the bid, cover the Medicaid, mandatory Medicaid, just like in my home state of Florida, that will become mandatory Medicare managed care coming in 2012. The importance of that, how does that allow you to relieve some of those dollars so you can spend it in kids that are waiting to be vaccinated, in educational programs, in public health, and in prevention, like you mentioned, like Dr. Torres mentioned?
Right now you can't, because the federal government has got its claws into your program. Mm-hmm. And CMS, federal government, their rules and regulations for Medicaid are as convoluted and confusing as anything you've ever seen at the IRS. It's layer upon layer upon layer of what we have to do, specifically how we have to do it, in what time frame we have to do it, and lots of times how much we get paid or can pay for it. And that is what the states are screaming to get out from under. Mm-hmm. There's this thing called a waiver, and a waiver is what we give to the federal government when we want to get out from under their rules. In New Mexico's a small state. It has 12 waivers. 12 times we've asked the federal government, please let us out from under your rules and regulations. Well, what we need, and what I'm going for, is really a global waiver. Get rid of all those itsy-bitsy requests and let us run our program as we see fit. And that's where we're going.
Yes. And it's interesting that you said that, Sydney, because as a matter of fact, you hear some of the officials in CMS in the current administration talking about the great flexibilities that they're giving to states. But in reality, one of the most important recent announcements, or at least promising announcements, has been the opportunity for flexibilities to work on the dual eligibles, those that are both eligible for Medicare and Medicaid, and the flexibilities to be able to foster better integrated care, more coordinated care, transparency in the value of that care, but also access and consumer protections. Yet, at the same time, they just came out with part of the regulations that they're requiring on the July 8th letter to each Medicaid director that says, we will give you the flexibility starting October 1st if you apply for this, but you will have to comply with all the Medicare regulations. Imagine, the Medicare regulations are like, I can't even begin to tell you, having worked at the department, and the Medicaid regulations, and plus the ones that you're going to have to impose at the state level. And how do you do that? That means that you're going to increase cost, and then you're going to completely do the opposite. The whole purpose of giving flexibilities to state to work on their dual eligibles is obviously to be able to improve the cost efficiency and improve the quality of care. Yet,
dual eligibles notwithstanding, the federal government is not giving us flexibility. They throw that word around, but they don't mean it. Yeah, you can have all the flexibility you want as long as you do it exactly the way they tell you to do it.
Right. It's true. You talked about prevention and the importance of prevention. What other things can we do as citizens, as informed citizens in communities, to be able to to take that message to our, to our families, the importance of healthy lifestyles throughout the entire spectrum of life. It means,
Well, what's interesting for me as a physician and even now as Secretary of Health is how involved the private sector is in the prevention message, sometimes better than the government. And even though the government talks about it, it is the private sector that has really moved that message and made it easier even for me in my new role is the partnerships, so that when people go to work, their employer has employee health, and that employee health even talks about wellness. I look at Hard Rock Casino,
Yes.
and the Isleta Pueblo are way ahead in the market of employee wellness. And you go and visit it, and it's not a big room. It's got one exam room and maybe 2 people, but the amount of things they do in that little office in encouraging walking and having their blood pressure checked and making sure they're eating well and getting control of their diabetes. I mean, they do all that in this little office. So it's not that you have to have tons of money given to things. People just have to be creative and innovative. And I began looking into the 21st century. There is a lot of things people can do that even if you go back into the 18th century, walking, growing gardens. I mean, that's been a big push here in New Mexico, even though we've had this horrible drought, is how do we grow vegetables that we have here and fruits, and how do we learn to live within our means and the land. And so that's the big prevention message. And for those of you here, I think it's really clear that we all need to understand healthcare reform. I think it's very complicated, but it's something that we need to learn and keep our representatives in Congress aware of, as well as our governors and our state legislators, because they get confused as we do, is what are we really needing. And really we have to be able to prevent bad outcomes. Preemies are a big thing. If we can get moms into prenatal care early on, we've proven that. We've proven that eating healthy, we do much better. Long term, we just have, and if we quit smoking, which is like the #1 thing, we really decrease the amount of cancer. So it's really those types of messages. And I do appreciate partners like United Healthcare and others like, I look at LifePoint, who I worked with in Las Cruces. They really do push the message of prevention, and I appreciate that.
Yeah, the other issue I think I wanted to talk about, both three of you, is the workforce issue, the workforce shortages, and the specialties. Having heard, both the immigration, having heard the jobs piece, how can we encourage, how can we reach into maybe high schools and even grade schools and middle schools to try to encourage folks to get in the health track? One of the areas where I think that there's a lot of employment opportunities is in the healthcare sector and the goods and services that will be needed for an aging society. So
Let me give you a couple of data points here. Some of the data I've seen is that Hispanics represent approximately 15% of the population nationally, roughly. And when you look at providers, that is physicians, only 4% of the physicians are Hispanic, 5% of the dentists, and 6% of the nurses.
Right.
There is a huge gap between the number of providers who are Hispanic and the number of individuals. One of the things that the research definitely shows is that people are more receptive to receiving services from people from their own cultural group, that there's a level of comfort. And the other thing it shows is that providers go out of their way for people from their own cultural group. There's a level of comfort there and familiarity. And so people who go to kind of same cultural group providers, Hispanic provider to Hispanic patient, get better outcomes. Then the question is, how do we increase those numbers? One of the things United Healthcare is doing through our foundation is we've got something called a Diverse Scholars Program. Last year we gave $500,000 of scholarships to Hispanic youth to get them onto the healthcare track. Now, that's a drop in the bucket in terms of what's needed. I think what we need to be doing is talking early in school, getting role models, the whole idea of creating the idea that it's possible to do these things, it's possible to go to school, it's possible to become a physician. There's a huge need, there's a huge shortage, particularly in groups like Hispanics, that we would welcome those. There's jobs out there, we've just got to get the kids involved, interested, and trained to do it.
But I think also, Russ, that we just don't limit to just, physicians. But we also need a lot of paraprofessionals and the allied health professions to be able to
Absolutely.
deal with such a, large growing population. So thank you very much. I think we're going to, thank you, Rosario. Right.
Thank you. This is great. This is awesome. A wonderful group of professionals. Let's start with the first question from Twitter. This is coming from DJ Hicken. I'm sorry. And it is a very simple question. How long will it take to modernize Medicaid, and what do you all think of the Representative Paul Ryan's plan?
Should I start?
Yes.
I'll be
Yeah, we
glad
only
to
have
start.
3 hours.
I'll be short. It's going to take quite a bit to modernize Medicaid. And as I said before, let the states do it. The federal government can't do it. The states are always the leaders, no matter what it is, welfare reform or education. The states are always the leaders, and the federal government follows. So we've got a plan in New Mexico. I've got a 4-principle plan. It has a lot to do with managed care organizations, getting bang for the buck, personal responsibility is big, paying for outcomes instead of just here's 10 tests, see you later. I want physicians to make people get better and stay better. And then I talked about the global waiver, and that's just a start of the things that we can do. There's all kinds of ideas. What about nursing homes who need a lot of money? I mean, they cost a lot of money. Why don't we also allow them to be adult daycare facilities? Why not? I mean, these are things that we could try right here. As federal government's never going to, I mean, we can't wait for them. I mean, we just can't wait for them. So there's all kinds of these ideas out there, but it's going to take a concerted effort. It's going to take a Congress and an Obama administration, or the one that's next, to allow us to do it. Right now, they've got the tight grip on us. But if they would just let us do it, we could fix this program, and just in the nick of time.
Okay. Let's see. Okay, go ahead, sir.
Let's talk business. I'm a gynecologist in Las Cruces. And if we take into account just my rent, my malpractice insurance, my girls' salaries, and my phone bill, not counting my supplies, my utilities, and God forbid I should make any money, it costs me $50, over $50 every 30 minutes to keep my office open. I'll pick one procedure. New Mexico Medicaid will pay me $46 for an IUD insertion, an invasive office procedure. Medicare will pay me $32 for a new patient visit, which in my office, I'm not somebody running patients every 2 minutes, takes 30 minutes. Can anyone up there please explain why I should accept Medicare and Medicaid?
I don't want to hold the whole show.
Russ.
Well,
Anybody, give it a try.
well,
Yeah.
because I know this gentleman in the audience, I know that because it is under Sydney's being, but really I agree. I think that is the hardest part for physicians and that's why it's hard to bring people in to the system of being doctors, because I don't think we've been valued, and people do not realize our time. And I'm hoping with the Medicaid modernization that physicians will have more input. I have been told that, and I have seen that with Secretary Squire, and that I agree. It's very hard for physicians to decide between the two when someone who doesn't even have insurance will pay you $100 to be seen, and are grateful for that. And so I think when we're looking at that, we really do need to look at the time that physicians and dentists and psychiatrists and counselors, even people who do sign language for us, it's not reimbursable. The physician or whoever has the person to do sign language for people who are deaf comes out of the pocket of that provider, which nobody's ever really paid attention to. And it's something that we have and is important. So I think as we look at that, that is something I have to agree that is happening at the state level, that I see is that what is that we need to pay the people who do that work.
And the Obama administration, just so you know, is not helping out. They're not helping you. Their first and foremost is cut the providers. Here in New Mexico, in my modernization plan, I do not want any kind of provider payments, and I don't want any cuts to your payments. That's not where I'm going. But this national administration that we have now, that's the first thing they say: cut the providers, cut the hospitals, cut all that. That's not the road to go.
Okay. Next question, the lady in black, and then the gentleman to your right.
Amy Sanchez from the University of New Mexico, student. My major concern, I have a lot of health issues, and my sister has MS, and I have immune system problems. And when looking for doctors here in New Mexico, we don't have specialists that are enough specialists and ones that have really good current information for us and healthcare providers. We even have trouble getting a primary care physician that's decent. How is New Mexico going to take that on and bring new doctors into the state, attract them, make them want to stay here, not just get their education here because it's inexpensive, but stay here?
Excellent question. You guys?
Well,
Yeah,
Cindy?
I think it ties back to the earlier question
Yes.
in terms of, can people who've gone through all this school have this technical expertise make an honest living?
Yes.
And the challenge, I think, with Medicaid in particular, is there's a lot of waste in the system. And what we have to do is figure out ways to be more efficient and more effective, to push the waste out of the system, to modernize the system. And I keep talking about modernizing the system because we require physicians, we require providers of services to do all kinds of unnecessary things, unnecessary paperwork, unnecessary activities, because it's part of some of
The
these.
administrative regulations that,
Exactly.
raise the cost of it.
And, we have certain costs. We provide data that I know no one looks at. We spend a lot of money providing data that nobody looks at. And so it's how do we upgrade the system, take the costs out, and then be able to give it to the people who are providing the actual services, and then to do the preventive services and have more time to make the system work a little bit better for everybody.
Right, and I just want to, that's where telemedicine is coming into play. But the issue is that there wasn't a way to pay the physician on the other side the telemedicine costs. And so those are things that, even though there are lots of advances in medicine, nobody's figured out how we're reimbursing that. So in New Mexico, we are going to have to rely. There's only so many specialists, especially in pediatrics. You can't have a specialist in every community. You have to have them where they're the most cost effective. And for us in New Mexico, it's in Albuquerque. We use El Paso, Texas. We use Lubbock. We use Phoenix. We use Tucson. We use Denver. But there's only so many of them because children don't all have, we don't have lots of kids, thank goodness, with all these problems. So we only have certain experts. But having telemedicine and being able to reimburse that provider is really key. And that is something with Medicaid modernization that I know we'll see come forward. Because that's true with psychiatry. We don't have a lot of psychiatrists in the state of New Mexico, but we certainly need people to be able to have access to that.
Yeah, excellent. Okay, the gentleman right next to. State your name and your organization, please, for the record.
I'm Orlando Baca, Santa Fe County Republican Party. And I just wanted to tell you all about this gal named Carla. Carla was the #1 student in her elementary school, one of the top 3 students in her junior high school, one of the top 10 students in her high school at Santa Fe High. Carla wanted to become a doctor. She has all of the prerequisites for it. At the Santa Fe Community College, she was the #1 student in the pre-med program or whatever it's called over there. But Carla, at Santa Fe Community College, decided, I can't become a doctor because Carla is illegal. Her parents brought her over when she was about 2 years old. Now, we talked about the immigration thing this morning. We're talking about the health care. Could Carla and all the other thousands of Carlas that we have out there, could they help out our problem with the health care?
Yes. I think the answer to that is yes. They can't. I mean, they can't right now, but with a certain amount of changes, some of the changes that you talked about in the panel before us, then the answer to that is yes. And New Mexico needs more than other states. I mean, we don't have enough right now. When you put Obamacare into play, we're going to need hundreds more
Yes.
doctors, nurses, paraprofessionals,
Workforce,
all of it.
absolutely.
And all the other states are going to need those things too. So why? What does New Mexico have that's going to bring those people to, instead of going to Southern California or San Diego, something like that? What do we have that's going to bring them here? And that is a pretty scary subject if you try to walk down that path. But yes, Carla could help.
Okay, wonderful. I have one more last question, and then we're going to go to the next thing. So the last question. There are no last questions. Okay, there's somebody out there with some
You can't
folder.
see.
You can't have the lights.
My name's Martin Mendez from Denver, Colorado. I'm with Colorado Hispanic Republicans. Coming here, I take a taxi. I'm at a different hotel. And yesterday morning, the woman that was driving me here, her name is Alicia, and she's here illegal. And she told me that she didn't want to come to America, but she had to come because her son had cancer. And she came to Albuquerque illegally. She dropped him off in a hospital, went back to Mexico, and then tried to get a visa to come back. Well, she couldn't get a visa, so she came back for her son, and she's been here ever since. So I would like the panel to address this issue of illegal immigrants coming to this country for health care. Thank you.
Okay.
I will just, part of it as a physician is that we don't have to ask where people come from. And so everybody that comes into our door is seen. And they're given the care that they would get no matter who they were. That's the beauty, I feel, as a physician in the United States, is that I am not forced to question where people come from or forced to know if they have to pay. I see them and they're treated. And yes, lots of kids have come into New Mexico and have received great care, especially through the University of New Mexico, especially through the Cancer Center. They're known for their leukemia care, and people will come. And we've done kids who have had bad hearts, and they come here, but it's not our role to question that. And they come. The same thing happens on the other side. I think sometimes people forget that people only come to the United States for care. Lots of people go to Mexico for care. We have lots of people who go there for dental care. They go there for eye care. They go there because care is less expensive. And they go there all the time. So it's kind of back and forth. And having sat on the U.S.-Mexico Border Health Commission, you see it, and it goes back and forth. So what it is that people come, and there's just no question. They're just taken care of. In the state of New Mexico, we have residents, and so that's how we deliver care in the state of New Mexico.
Yeah, well, thank you so very much. These are, thank you. Thank you to our panel. Clearly there is, for the doctors and the nurses, the challenges are real, certainly compounded by some of the issues that were brought forward here. I think that the most important thing that we need to realize is that somewhere, somehow, healthcare needs to be reformed. And to do that, we're going to have, those of you that were not here yesterday, we're going to take this opportunity to send a message to the White House with the postcards. There's a postcard in every single chair here. We need, and actually it reads, President Obama, your healthcare law fails to address the cost of care, improve access, or save Medicare. Enact real healthcare reform by repealing Obamacare, empowering physicians, and fixing Medicare for our children. So for those of you that feel compelled, that are compelled to send this message, I want all of you to write your name, sign it, and there is a box in the back of the room where you can drop it. It will go to the president. Clearly, we heard from the panel, there are some very serious challenges, and this needs to be repealed. For your information, just like for yesterday, we will pick a winner, and you'll get an iPad 2. So there is an incentive.
Oh, great. I got to fill one of those things out.
Okay. Before we go to the barbecue, we would like to share with you one last video from a young national star, young, dynamic, handsome, Senator Marco Rubio from the great state of Florida. He is an inspiration to so many young Hispanics who want to serve our nation and build a better future for all the Americans. And as we're going to show that, we want to greatly acknowledge the panel and thank them profusely for their insight. Thank you.
Hi, I'm Marco Rubio. I apologize I can't be with you in person today, but I appreciate your invitation. I'm sorry I missed you when you were in Miami as well. We were on a trip overseas to Afghanistan. I want to say hello to two very special people, two great leaders, Governors Martinez and Sandoval, who are both doing a phenomenal job out west on behalf of their states and on behalf of our party. And I want to congratulate you for what you do. And I know the theme of this event is the American dream, and it's more important than ever before. I think we understand that the American dream, its foundation is the free enterprise system. A free enterprise system that has allowed more people than ever to access prosperity, and more important, to leave their children better off than themselves. The free enterprise system, unfortunately, is under assault by government regulations, by a broken tax code, and by a runaway debt, which is keeping job creators from growing our economy. And the result is that many of our children and our grandchildren, people who have worked hard and played by the rules, done everything we asked of them, they graduate from college and they cannot find a job. And if they find one, it barely pays more than the one that people that didn't go to college are getting paid. And that's not what we promised them when they were children. We told them that if they did the right things in America, you can climb the ladder and succeed economically, provide stability and security for your family, achieve your economic dreams, and leave your children better off than yourself. Well, that's still possible, but it's only possible if we re-embrace the free enterprise system. If we realize that the job of government is to make it easier for the job creators to create jobs. That means tax reform. That means regulatory reform. And that means a real plan to bring the debt and the deficit under control. I'm grateful for leaders like Governor Sandoval and Governor Martinez. They understand that, and they're leading the way in their states, as are governors all across America. If only we could bring some of that to Washington, D.C. I'll continue to work hard on behalf of you to make that happen. But I thank you for this invitation, and I pray and hope that soon I'll be with you in person at your next event. Thank you so very much. May God bless all of you, and may God bless our country.
Awesome. That is awesome. He is just fabulous and certainly a beacon of hope for so many of us, Latinos and Latinas, and Cubans and Mexicans and immigrants and Americans. All right, so after all these panels, I hope you are as hungry as I am. I am very hungry. I want you all to join us. Let me just clarify something. We are going to have a raffle. Not everybody that turns in is going to get an iPad, but if you do turn in your postcards, you will be in for a raffle, okay? The restaurant is outside the plaza, and we're going to have celebrating our youth, living the dream barbecue. The food will be great, and our speakers will be even better. We have really, really one in particular speaker that you will not want to miss. Okay? Thank you, and we'll see you at lunch.